Hello everyone. I hope you guys are doing great and getting healthier day by day. Today's video is very special and I have dedicated this video to all pregnant women or women who are planning to get pregnant in future. In this video, I'm going to talk about prevention, diagnosis and management of gestational diabetes. The gestational diabetes or diabetes of pregnancy is by far the commonest type of diabetes in pregnancy. If not treated properly and timely, it can lead to myriad of serious complications. Fortunately, it is preventable in most of the pregnant women. Gestational diabetes is defined or described as high level of sugar or glucose detected first time during the pregnancy. Very rarely, new onset type 1 or type 2 diabetes may manifest first time during the pregnancy. There, the HbA1c level and the sugar levels will be very high. Gestational diabetes may affect up to 8 to 16% of pregnant women. In normal pregnancy, there is a fine balance between the hormones which are controlling the sugar levels and the hormones which are required to maintain the pregnancy. But in women who are at risk for gestational diabetes, this fine balance is disturbed, thus leading to higher insulin resistance and reduced insulin performance, which results in development of gestational diabetes. Now, who are the women at risk? So, women who have sedentary lifestyle, who are overweight or obese, age more than 30 years, family history of diabetes, past history of gestational diabetes, certain ethnic origin, people like people from South Asia, from Middle Eastern countries, as well as Asian American or African American and Hispanics. Then if somebody has history of polycystic ovarian syndrome or someone has delivered a large baby weighing more than 4 kg, they are the people who are at risk for gestational diabetes. So how can we prevent gestational diabetes? A proper pre-pregnancy counseling in women who are planning to get pregnant can actually save them from gestational diabetes. Maintaining healthy lifestyle before pregnancy, maintaining healthy weight, and doing the lab tests which are required to be done before pregnancy to check the sugar levels and HbA1c levels, which will give us a rough idea that this person is at risk for development of gestational diabetes. So, what is the best time to screen for gestational diabetes in pregnant women? Ideally, all women with pregnancy should be screened as soon as pregnancy is confirmed. If not possible, then at least all the high risk women should be screened. Now, in the first trimester, if the screening is done, it should be done with the fasting blood glucose and HbA1c. If that is abnormal, then the further testing can be done. But if it is normal, then the further testing will be done at 24 to 28 weeks of pregnancy. Now, what is the best test to screen at 24 to 28 weeks? There are 2 or 3 different types of tests, and different people have different preferences in different countries. But most widely used is the one-step oral glucose tolerance test, which is conducted with 75 grams of oral glucose. And this has been recommended by WHO and American Diabetes Association. In this test, after 8 hours of overnight fasting, a pregnant woman goes for the lab test for the fasting sugar, and then after that, she is given 75 grams of glucose liquid. Subsequently, 1 and 2 hours after that glucose liquid consumption, the blood sugar is tested. Now, if the fasting sugar is equal to or more than 92 milligram percent, our 1 hour value is more than 180 milligram percent, our second hour value is more than or equal to 153 milligram percent, then we label that woman is having gestational diabetes. So any one value, if abnormal, will be will be considered as that she has gestational diabetes. The main complications which can be caused by gestational diabetes include in mother, it can cause development of preeclampsia and high blood pressure, thus warranting early or preterm delivery. There's a more chance of cesarean section and more obstetrical intervention. There's a risk of development of type 2 diabetes in mother in future. In fetus or baby, it can cause the development of large baby weighing more than 4 kg. Then there's a risk of birth trauma and shoulder dystocia. There's a risk of hypoglycemia or low sugar at birth, leading to admission in ICU. It can also lead to stillbirth if the baby is not delivered on time, and there's increased risk of type 2 diabetes and obesity in baby in future. So who is the best doctor to manage gestational diabetes? An endocrinologist or a certified diabetologist or a gynecologist, a physician who is experienced in managing gestational diabetes. The management of gestational diabetes includes 4 important things. Number 1, medical nutrition therapy. Number 2, exercise. Number 3, medications in form of oral or insulin. And number 4 is self-monitoring of blood glucose. Good news is that 80 to 90% of gestational diabetes cases can be managed by medical nutrition therapy. And it is strongly advisable that these women with gestational diabetes, they should consult a medical nutritionist or dietitian for the proper guidance. Some important things to remember in diet, that the diet should be healthy and balanced, including complex carbs and refined carbohydrates, high proteins, and it should be rich in vegetables, salads, fruits and nuts. Then processed and fast food should be avoided, and juices, soft drinks, etc. must be avoided. Now exercise, if the lady with gestational diabetes is not on bed rest and the pregnancy is more than 12 weeks, exercise is recommended in form of walking and stretchings. It is recommended that there should be at least 45 to 60 minutes of moderate to brisk walk. Now, the easiest exercise or easiest thing to do is to walk 15 to 20 minutes after each meal with the normal speed. If you are doing walking in empty stomach, you can do the brisk walk. Then 15 to 20 minutes of stretching exercises must be done as recommended by your treating gynecologist. Then medications, they include oral medication in form of metformin, which is most commonly used medication worldwide, except few countries where it is not approved. And second is injectable therapy in form of insulin, which is approved all over the world. Now, insulin, when we are using, only safer insulin and approved insulins should be used. Last but not the least, the self-monitoring of blood glucose is very, very important part of management. It should be done by a reliable glucometer or a continuous glucose monitoring device, where if somebody is afraid of pricking. And it should be done at least 4 times per day. The first one should be in fasting, at least after 8 hours of last meal in the night. And the other 3 readings should be after each main meal. You can check it either 1 hour after the meal or 2 hours after the meal. And the targets are that the fasting sugar should be less than 95 milligram percent. 1 hour value, if you are doing it, it should be less than 140 milligram percent. And if you are doing 2 hours after meal, it should be less than 120 milligram percent. Now the crucial question comes that when is the best time to deliver? The pregnant women with gestational diabetes, they must be delivered between 38 to 39 weeks of pregnancy, with few exceptions where some complications may happen and the delivery may be preponed. Now, what should be done after delivery? Because many pregnant women with gestational diabetes, they don't go back to their treating doctor after delivery. So after delivery, you must visit your treating doctor 6 to 8 weeks after. And that time your doctor will advise you to do a glucose tolerance test again. If that test comes normal, you should follow every 1 to 3 years with your doctor depending on your risk level. And during this time, you must maintain healthy lifestyle and healthy weight so that you can prevent type 2 diabetes in future. There is 40 to 50% risk of development of type 2 diabetes after delivery in women who had gestational diabetes during pregnancy. So the key takeaways to remember that gestational diabetes is the commonest type of diabetes during pregnancy. If not treated properly and timely, can lead to serious complications in mother and fetus. Fortunately, it is preventable in most of the pregnant women. It must be managed by an expert. And the good news is that 80 to 90% of these women with gestational diabetes can be managed with proper diet and exercise. Now, the last and the most important thing which I want you to remember is that consider gestational diabetes as a warning signal. And when you learn the good things about the lifestyle, like diet and exercise, don't forget them after delivery. Because if you don't maintain the healthy lifestyle after delivery, there's a very high chance that you may develop the permanent type 2 diabetes. So take care of yourself and your child, and good luck.